In order to help healthcare professionals to manage cow's milk allergy, there are lots of different guidelines that have been published and very good international guidelines that really support practice. I want to start off here with the most important factor in terms of the management, and that's breast milk. And I think one of the important messages for us to get out today is that breast milk is also an ideal source for children with cow's milk allergy. There is no international guideline that does not mention breast milk as a desirable or ideal source of nutrition for cow's milk allergy. The challenge here for any healthcare professional, though, is if a child exhibits symptoms of cow's milk allergy, do I therefore take out cow's milk as a product, as a food and derivatives from the maternal diet? We have written international guidelines with the European Academy for Allergy and Clinical Immunology, in particular also looking at non-IgE mediated allergy. But the overall or overarching guidance is the same, which is as follows. If the child does not exhibit any symptoms whilst breastfeeding, so you have no symptoms, no rashes, no eczema, no diarrhea, no constipation, it's only with the introduction of either cow's milk in complementary food or as formula, you would not go and eliminate cow's milk from the maternal diet. Conversely, if the child, however, exhibits symptoms whilst the mother's breastfeeding, any of the symptoms that I've mentioned, then it's worth performing a maternal elimination diet. But when you perform an elimination diet, your diagnostic process is not complete unless you reintroduce. So we normally say around 4 weeks of elimination, and when I say elimination, you do it properly. We do everything, so cow's milk derivatives, everything. And you of course think about the supplementation for the mother, in particular around calcium and vitamin D. And then you finish that cycle of diagnosis and reintroduce it to confirm your diagnosis. And that will give you guidance within the breastfed child whether you need to eliminate cow's milk from the maternal diet, yes or no. International guidelines also discuss the use of specific or specialized formula for the management for cow's milk allergy. Now, let me be clear. This is either for a child that's not breastfed or for a child where the parents want additional top-up feeding. So that is the only time when we would be saying you would use a specific formula. These formulas can be categorized into either an extensively hydrolyzed formula, that is either extensively hydrolyzed whey or extensively hydrolyzed casein, or an amino acid formula. I'm going to start off with the indications of an extensively hydrolyzed formula. And here, thank goodness, there's a huge amount of overlap and agreement that around 90% of your children will be doing absolutely fine on an extensively hydrolyzed formula. So your first port of call generally would be an extensively hydrolyzed formula. So let's think now about when is an amino acid formula suitable. So I myself have been involved with a review of when it would be suitable. And I think broadly speaking, and that's also reflected by all of your international guidelines, you would use an amino acid formula in the following cases. Of course, a child that has failed an extensively hydrolyzed formula. Secondly, children with multiple systems, so for example, skin, the gastrointestinal tract, so multi-system involvement, in addition to multiple foods that need to be eliminated. So those really complex children. And key to this is, and I think most important, in children where there's faltering growth. In those patients in particular, we know amino acid formulas are indicated. There are two other categories where I always say these two categories generally, and that's also highlighted in the guidelines, you would from the start go also to an amino acid formula. And first one is anaphylaxis, and that's consensus based. So if a child has got a proven anaphylaxis, really whatever guideline you look for, you will find that they suggest an amino acid formula. And the other one, also really supported by great evidence, that's eosinophilic esophagitis. So you would absolutely, in those cases, that would be your first port of call. So the most important message for me is, if you have in your head that the specialist formulas, extensively hydrolyzed or amino acid formulas, are for children with a proven cow's milk allergy. The vast majority would tolerate an extensively hydrolyzed formula, but in specialist cases, those with faltering growth, multiple food eliminations, those also with multi-system involvement, anaphylaxis or EOE, those would be the candidates where you'd be leaning and certainly be thinking about an amino acid formula as a first choice.